for our today's update on the COVID-19 situation here in British Columbia. I'm going to be talking about the two time periods, so the 24 hours from Saturday to Sunday and then April 5th to today. So from Saturday to Sunday, we had 26 new cases test positive for COVID-19 here in British Columbia. And then for today, we have an additional 37. So that is 63 over the last 2 days to bring us up to 1,266 people in British Columbia who have tested positive for COVID-19. That includes 586 in the Vancouver Coastal Health Region, 450 in the Fraser Health Region, 79 on Vancouver Island, 128 in Interior Health, and 23 in the Northern Health Region. In addition, we now have 210 cases who are associated with long-term care or assisted living. All of them have been in the Fraser or Vancouver Coastal Health Region. So we now have 21 active outbreaks in those regions, three of the previous ones have been declared over, which means there have been no cases for 2 incubation periods. So that's good news around that. Currently in our case status, there are 140 people hospitalized across British Columbia right now, and 72 of those are people in critical care in ICU or in the high acuity units. We've had one additional death in the last 2 days, and that is a community death in a known COVID positive case, a man in his 40s, and the coroner's service, as with all sudden unexpected deaths in the community, is investigating. We have had 783 people who tested positive who have fully recovered. I do want to also say that we've had community outbreaks, as you know, in a couple of different situations, and we've been advised of another outbreak in a correctional facility, this time a federal correctional facility in Mission, where there's, as I understand it, 2 positive inmates in that facility, and an ongoing investigation and outbreak response is actively activated there. This, as we've been saying, this is in the middle of our critical weeks here for COVID-19, and we must be steadfast in our commitment to holding the line right now in BC. We continue to see clusters and outbreaks in our communities and at facilities, and these hotspots are very concerning. They can quickly escalate and challenge our response, our ability to keep things under control. Our percentage of new cases, as you can see, has been slowing. It's been bending, and that's really important, and it's testament to the effort that everybody here in British Columbia has been making over these past few weeks. But we must keep that firewall strong. My focus this week is to be supporting you all in making sure that we are doing what we're doing that's making a difference. And you need to continue as well to focus on everything possible to break those chains of transmission in our communities across British Columbia. We've talked about travelers coming home, and it is important for us all to welcome them travelers home, but make sure they have the means to join us in this and do their part by following the orders of self-isolation for 14 days after they come back here. We understand the many sacrifices that are being made across the province right now to ensure that we do our best and everything we can to protect our families, our communities, our healthcare workers, and our healthcare system. I also know that it's been challenging for many people, and I want to really encourage us all to continue to be kind with those who have to continue to work, whether it's in the grocery store, whether it's healthcare workers, people working in pharmacies. I know sometimes it's challenging when we've been going through this whole isolation and not having the usual contact and the usual things that we need to do. I think it's important as well for us to recognize that we can have anxiety, and there be anxiety that is being expressed by our children, by our family members. I encourage people to talk to your physician if you have one. They can talk to you through virtual care. They can support you, and particularly if you're somebody who has an underlying illness and needs to have that ongoing care, they are the best people who can support you in that. I also would recommend that people think about ways that we can support each other in reducing anxiety. And I know there's a couple of websites, for example, here in BC that are really helpful, including Anxiety Canada, where there's some really great information that you can think about how you're dealing with COVID-19, and also for young people and people in your life to support them as well. The other one that I know is Bounce Back BC, also a very helpful website to get resources to support yourself and your family. So we need to redouble our efforts. We need to keep this up. We need to continue to work to stay home and to do our part, but to support and care for those around us at a distance. And I'll say again, this is our time to be kind and to be calm and to be safe.